Kalimera, good morning to everyone. Sorry for this little gap in the program. It happens in live broadcasts, as you well know. I would like to welcome everyone. My name is Vassiliki Angouridi. I'm a health editor. I'm going to sit and take my place. And I would like to welcome you all to the first panel discussion of Athens, this year's Athens Digital Health Week on the European health data space. And I think Professor Schizas' keynote presentation kind of gave the essence of the regulation, which, as I think all agree, characterizing it as just a key regulation, it just falls kind of short on the importance and the potential for member states and their health systems, for research, for innovation, and for patients at the end of the day. Information is not only king, we used to say that, but when it comes to health data, I'm sure that everyone agrees here that with the help of technology, health data could be a very valuable tool, giving people the access to and control over their health data actually empowers them to make good decisions, to live more healthy, improves on their well-being, as Professor Schizas said, but it also empowers health professionals to make informed decisions, and it generally improves on the health provided. The HDS aims to transform healthcare in Europe, as I understand. As Professor Schizas mentioned, it means to kind of achieve the most coveted goal of all, as it is the resiliency of health systems. And first of all, I think it's a vehicle that drives us to a European Health Union. That's another very coveted goal. We form that European Health Union that kind of serves everyone, and at the end of the day, mostly citizens and patients. So just not to take any more of your time, the HDS echoes common needs, goals, values, aspirations, and visions. It is a question, will it usher, at the end of the day, a new era in health across the EU? My esteemed speakers are going to help us kind of touch upon the priorities of EHDS. I would like to start with Professor Schizas, if I may, because he gave like a very comprehensive speech on the regulation. What does it mean for the future of healthcare in the EU? What would be the next day when the regulation, Professor, finally takes shape across the EU?
Well, it's not going to be a next day because this is it's progressing. Mm-hmm. So it's not going, we change, it's a machine, a new iPhone, and the next day of the use. Mm-hmm. We won't realize it, that is happening. But I think over the next 10 years, assuming that these things are going to be applied, we're going to see gradually coming into our lives things that in order to see what is today is to go back 10 years and see where we were and where we now. It's not going to happen suddenly, but gradually.
Okay, so what are, because you mentioned it's all about the citizens, what is the HDS going to bring to citizens across the EU, not only in Greece and Cyprus, but in Germany, in France, in Ireland?
The most fundamental thing, as I described, is where I am, irrespective of geographic barriers, mm-hmm. Cost, I will have available the treatment when I need it in an emergency, so I won't think about this that preventing me from having help. This is a dream. This is how it's termed about. So we're working for this to happen. And second, to avoid illness through prevention. We have to promote prevention to lower the cost. I mean, you made a study. When we have fully utilize the European Heritage Space Regulation, we're going to save about 11 billion euros a year for the whole Europe. It's a big amount. Only the cost, without counting that people will be healthier, we have less illnesses, and better life at the end. These are the values we are looking for. But I don't want to ask the rest.
No,
of my
I mean, the
colleagues.
same question goes for everyone. And the kind of extend that question, what does the new regulation mean for health systems? Can you elaborate on what are we expecting to see in 10 years' time when it comes to the...
Of course, the EU has a plan by 2030, and actually the output of the extended EHR, that will be the patient summary, e-prescription, medical imaging, discharge reports, and the lab reports to generate the implementing acts that will have to be implemented by 2030 by the member states. And as Professor Schizas highlighted, although there is primary use and secondary use, the concept is that at the stage we are now, where 14 member states are exchanging a patient summary and e-prescription, and Greece is one of these 14 member states. We hope Cyprus will be the 15th one. We are working very hard for this. Actually, EU has in place a plan where all these, the EHDS concepts will be implemented both in the context of primary use as well as for the secondary use. Also for the secondary use, most of the member states are participating now in the secondary use pilots that where the concept will be similar to the primary use. For each member state, there will be the national contact point where all the member states will be connected, for the exchange of secondary use data. And actually, last week, the EU will make available the first package of software that will be make available the member states to be connected.
So from what I gather, member states seem to be moving into different speeds when it comes to adopting the HDS. So how can we make sure that they kind of, match up when it comes to, find each other?
I'm afraid this is very asynchronous, and Niki can add in this, because we have member states running at different speeds. We have the EU regulation that has just been adopted. We have to implement it by 2030, and we all need to be synchronized on these components.
This is very important. Unless every European country comes to the same level, we won't achieve how it's done. Local governments must realize this. They must somehow forced to understand this. EU is providing enormous amounts of money for the member states when they want to come up to speed. So somebody must make these local governments, the states, understand. I'm saying, for example, here in Greece, they are aware. For many years, they were behind. But today, they realize, the political, the government realized this and is taking advantage of this amount. So unless you do this, there is no hope. When the EU starts giving penalties to countries which do not comply, and this is another issue, for pollution, environment, we pay millions of euros a year, because when such regulations were in place, we are not applying them. Now they are paying penalties. At some stage, they will pay penalties they should, when they don't become up to standards and exchange data. So scientists are there, they don't listen to them, so therefore it's at the EU level to start paying penalties, and the other member states, since we're talking about solidarity, to help the rest of the countries to come up to standards, to come up to speed.
So
Thank you.
until we get to the penalties, I guess it's kind of, like you said, trying to find a way to get everyone on the same page. And I would like to go to Ms. Tsouma. And how does the regulation guide national authorities like IDHICA to their goal, to be prepared for implementation of the HDS?
Well, I'm afraid that I'm not the proper person to talk about the European regulation and how it affects to IDHICA or Greece, because I'm an IT guy. So when I think about regulation, I think about laws, and I think that laws should be prepared by lawyers or people that knows all this bureaucracy thing. In my perspective, I'm technical, and we are working in an IT organization that we are trying to be interoperable with.
It's a difficult word.
Oh, yeah, it's a very difficult word indeed. With all our colleagues in all other European countries that they are working or living or every day have these systems ongoing. So the critical asset for us is how in a technical way these systems will talk with each other in a secure technical way, and in order to have security in the exchange of these data, because these data are very sensitive. So that's one thing we are thinking about. And the other is how to talk, how the systems to talk in a technical matter. I think that the technical matter does not want any else regulation, but only the technical rules. They are very strict. So in a technical way, there is no way from one point to another in order to connect, not to have technical rules. So in that point of view, I think that we are in the technical matter going well with the technical teams, and we're waiting about all this regulation thing to see what will ask for us to do, maybe in another level or in another prescription. But now we are working on the technical matters, which are very strict. So they are regulated from their own the systems.
Okay, Professor Bamidis, there is a very important ingredient in all of this, which is people at the center, and effective implementation of the European health data space regulation kind of needs digital literacy. It needs people with special skills or different kind of characteristics as far as characteristics. How can we achieve the scale up of digital skills of all stakeholders? And do you see a need of for different types of professionals, different kind of skills when implementing the HDS?
Okay, I can talk with the two hats that I wear in this event.
Great.
The first one is the chair of the HL7LS, the organization that is essentially promoting standards in the ecosystem of e-health, basically. That's why it was developed as an organization and founded more than 20 years ago. So we are trying to cultivate all the ecosystem, which includes, of course, academic environments, which I will talk to next, but also the industry, policymakers, etc. We are trying to bring them up together to events like this one, to discuss the essentials, and then to follow up with specific recommendations of action, I would say. And I think last year, when we had the Athens Digital Health Week, we discussed about this. We had specific sessions on capacity building, trying to cultivate this notion of getting to know what are the essentials for achieving the regulatory aspects, but also the technical aspects and stuff like that. And we had various discussions at HL7LS, and I think later today we are launching one of these activities, which is the FHIR working group, and my colleague Nikos Kyriakoulakos is here. He's organizing this in a way that it can bring people together from the local ecosystem and train them in a way that they know what this is all about technically, but also from regulatory points of view. And I think during the whole week we will have different experimentation sessions, which will drive the technical aspects of the frontiers, but also various discussions. On another hat that I'm wearing, that of the professor of the School of Medicine at the Aristotle University of Thessaloniki, I think it's my daily bread, I would say. I need to educate the professionals, the forthcoming professionals, the doctors of tomorrow. And what we are trying to do is not make them technically capacitant to perform this, but cultivate them in a professional way, the mentality, what all this is about, and how necessary interoperability aspects are, the exchange aspects are, to promote health and to make better health, the vision that Professor Schizas was talking about. And after this session, I think we start with one of those sessions on capacity building, where we'll present a master's program on this healthcare transformation and its management.
I will go back to Ms. Tsouma I think I left something uncovered, which is, because you kind of touched upon it a little bit, but I would like more insight on it. How does IDHICA, could you talk a little bit about the programs that you are kind of working within the EHDS, within promoting e-health and digital health across Europe as a national authority, just to give us kind of a few examples of how national authorities help within this framework. So in what kind of project is IDHICA currently, has its hands on?
National authority?
Mm-hmm. Well, IDHICA is it's a Alpha Epsilon. Yeah. I mean, I can just kind of, what project is IDHICA currently working on within the EU digital effort? I mean, I'm calling a national authority with the very broadest of terms.
We are not generally a national authority. We are the national focal point for the patient, the exchange. We're only that. We're not a national authority for everything, because that's very general. We would like to be an authority, but for something very special and for something very steady. And we prefer IT in an IT role. So we are involved in many European projects right now. I'm not ready to remember them with their acronyms.
Just the most important
ones. We are involved in a project that we are scheduling, or the European vaccination card.
Okay.
Yeah, which is coming from our knowledge about vaccination and vaccination cards in Greece, Greece were very successful
It
in
was a success story.
the COVID period.
Yeah.
So we are working on that project. We are working on all this project with Mr. Schizas or Mr. Bamidis or the HL7. We are extending the health record in a matter that now it is working in in all countries, and we're participating in all the work groups about the European space, the European health data space. We have our opinion and our knowledge in there, but together with all our colleagues in Europe.
Professor Schizas, you talked about during your presentation about the joint action XDHR. Could you elaborate a little bit more on what it will offer?
Yes. In fact, IDICA is participating in XDHR, in EU BAC, in TETAS2, in all the action.
It kind of comes to show that, I mean, bodies in national and member states have like a big saying. It's not like a European thing that comes from above. It also is built up from below. That's what I wanted to kind of, highlight.
As I said earlier, the XDHR is the joint action which involves all the European countries and Norway in addition, and is the action that is going to deliver the most important implementation acts for the European Health Data Space Regulation.
Okay.
This is a very big, I say action, but a very big responsibility, because the results of these, the outcomes, will be given to EU and become part of the standard for facilitating the European Health Union, is to make this interoperability standard, for example. The electronic health record standard, exchange format, all these are going to be developed and become available to the nations, to the implementers, to the software companies who are going to develop the systems to make this a reality. It's a huge responsibility, which is not going to stop in April, but it will go further, exploring these ideas. This is very important. But to do this, you need people to be educated. As Panagiotis said, we have to start this involvement of the stakeholder engagement. It's in all project, is there. We must involve, especially the citizens, as we call them, the patients. The citizens which are future patients at some stage must be involved. And this is the force that we use to make politicians aware. Through there are pressure groups that the politicians are listening to, and we must use them in a nice way to exercise force in politicians. And this is the example I had in Cyprus when we were voting unanimously the health law. We have involved the patients, the organized patients, that when politicians listen to the organized patients, they conform. That's one thing. And the second, we are educating the future doctors. Introducing e-health at the medical school in Cyprus was at that 15 years ago, and they said, well, what is this? In the medical school, we don't teach these things. And I exercise force that this course must be taught to our future doctor. And I see today, 15 years after, our doctors graduating with a big knowledge of e-health. Okay, so this is the way to facilitate the application, not just by law and penalties. I mean, it's not going to work. Make people aware. Thank you. If I talk too much.
No, it's okay. Mr. Patichis, I mean, at the end of the day, the HDS is a trust exercise. It needs the citizens' trust. It needs the stakeholders' trust to invest in it. Overcoming skepticism is a very difficult thing, and it's a big discussion also. Is there skepticism still among citizens and stakeholders? And how can we gain that trust? How can it be overcome?
I think the application of the European health data space is one way. I would reiterate what Professor Schizas and Professor Bamidis made before. The three main thrusts, I would say, of EHDS is, of course, the exchange format of e-health record and to achieve one space. And Christos actually made a very positive projection worth union projection that hopefully these concepts should be rolled out worldwide. So first is the exchange of the EHR and all the related data. Then second, we need to involve all the stakeholders, of course, as has been said, but also the citizens. It's very important to engage the citizens. And then the third component actually that is highlighted also in the HDS regulation is that each member state needs a digital authority. Cyprus was, Professor Schizas played a catalytic role in establishing the national health law in Cyprus in 2019. And now with the voting of the regulation in 2025, every member state is kindly asked to have a digital health authority in place so that the EHDS will be made a reality.
Okay. Professor Bamidis, you talked a little bit about training and preparing the people that operate the different aspects of the HDS. Are there specific efforts or projects that are underway, both here and across the EU, that kind of usher that?
Yes, I mean, there have always been some projects on training and, training the local ecosystem or training specific professionals. But I think now there are specific programs at the EU level which promote just this, common activities, common training project. The EU for Health, for example, program is targeting a lot on upgrading the knowledge about these issues, not only e-health, but interoperability, but also other issues, and promoting countries to jointly have activities like joint courses, joint training efforts, etc. So there is a bunch of these. I think a couple of them, like Panagiotis, Xia, and others, are presented in this Athens Digital Health Week, as they have. It has been the case last year. But I'd like to underline that with all these joint efforts, it's not like in the past we tried to cooperate and do something with a common goal. Many of these projects have got also the notion of co-creating the courses, which is essential. I mean, what is the needs for treating these aspects in Greece? What is the need for treating these aspects in Finland or Portugal or elsewhere or Cyprus? Then we try to build courses that will enable the training of health professionals and citizens and industry players within these needs. And then they will be ready for the EU health data space, so to say.
Well, you mentioned citizens and training, and digital literacy among citizens is a big question mark and a big issue, and it's kind of strange because we seem very hesitant in using or accepting the use of our health data, but we use banking applications and we share our banking data every day. We travel, we use. How can citizens' literacy, digital literacy, can be promoted? Does it need a mentality shift? Should that be taken to the people directly, to schools, to?
I think schools are essential, but I think in the last few years, I would say more than 6 years, we have less resistance and more, I would say, conformance to such developments, so to say. I think, especially the new generation, the natives of ITs, etc., they are well prepared to drive these, but also other generations like our generations are. It has become a common sense now that we need to do it. Otherwise, you cannot have better health. You cannot have, cost effectiveness, etc. And a few of the examples that also IDICA performed during the COVID pandemic, I think it made the case. It made the case that if you do things properly and digitally, I would say, then it saves lives, it saves costs, it makes health with better quality. But I think it also needs to establish citizen awareness weeks, and I think we have some elements in Athens Digital Health Week this year as well, like the patient forum tomorrow, etc. But I think we need to extend it further, to have a whole day, I would say, where we invite citizens to talk to us about their health and about their vision of digital health. And then the industry forum can perhaps coupled with a citizens forum and have these two combined at the conclusion.
Again, a bottom-up approach, let's say. I would like to just briefly touch upon, because we don't have much time, on the secondary use of our health data, and kind of let all of you kind of give me your thoughts on how can we ensure the proper secondary use of health data. Can I start from Ms. Tsouma on the end? What do you think is needed, to ensure that we're correctly using promoting secondary use of data?
Well, I have some other thoughts. I think that we are the responsible for all these things. We have to persuade citizens to trust us. I have the opposite aspect of this, because I trust a doctor about what happens in my health. So why citizens don't trust public sectors, public IT sectors in all this talking about? I think because we don't have explained that it is not something you have to fear. Well, that's my point of view. And the other point of view in all this discussion is that we have to do friendly services to citizens in order to understand that all the services are made for them. We do not do something about us in any matter. So we are working and we are producing systems about them. So we have to be friendly, we have to be open in what we are discussing about all these things, and we have to gain trust. So education, I think, should be in that way of teaching, and you're not going to teach all the IT aspects to somebody. So I'm never be a doctor. So I trust doctors in the rules that they are giving to me in order these rules to be IT program. So that's a circle and it goes around and around. Secondary use, yes. I have no already, till now, in my mind, what is exactly the secondary use. I think it is statistics. If it is statistics, statistics are already exists in our lives. It is anonymized data, but it is not secondary. So I have not clear in my mind what secondary use is in real life. We are discussing it. We are having our different points of view, but in practice, I am not sure what is secondary use of data exactly is in a matter of day-to-day work. So I have no clear idea about it in a technical matter. I insist on my technical point of view.
Mr. Vatikis, your point of view on secondary use of data?
I think the secondary use of data will play a catalytic role in 10 years' time in the practice of medicine. Okay. It's the only way, actually, the infrastructure will be built, hopefully, I would say by 2030, although we have the first pilots in Greece and Cyprus, actually, 2027, the health data access bodies to be there, and then in the context also of the TECTAS program that is for secondary use. So there will be the national health data access bodies connecting member states, and then member states will begin slowly, I would say, publishing data sets from their practice of medicine. So this means that especially for rare diseases, in Cyprus we are just 1 million. It would be easy, for example, to find similar cases in other member states. Data is the key driving the decision-making and the next, I would say, AI tools that will be given to the health professionals. And let me make a clarification. AI will not replace the doctors. AI will help us give a better set of services to the citizen. Also, AI will help the citizen. And let me make another clarification. AI cannot cover all the cases. And so that's why we need transparency and explainability in AI and in our decision-making process to overcome the black box concept. So I think that there is very high prospect.
Professor Schizas? Yeah.
In addition to what Kostas just said, secondary use is used for planning, for politicians, and to do decision making about the diseases, the trends. Also can be used for companies to prepare the health planning. That's very important, and a real secondary use of health data, because as I stress there, for secondary use when developing tools are coming to serve the primary use, especially when you discover something down the road, when you examine the data and be able to come back to the owner of that piece of data, and which is a very difficult aspect to do, and give cure to that citizen from where the data was originally taken. And this is difficult, and also when you discuss this at the highest level, there's a lot of resistance from countries because of the groups to allow this to happen. But eventually it should happen this way. So built on secondary use to elevate the primary and the best use on citizens. Of course, having said that, I would say that these ideas were on table for many years back, and it takes a long time to become a reality, because in health you don't see the progress and the benefit directed to the citizen, and they lost hope. So when we start talking to people about e-health, and we don't give them one application like you give in e-banking, where you go to the kiosk and you give your card, you come with the Uber and you give your card, and this is a real application. In health, we don't have this yet. And when we give lectures in villages, which I have hundreds of villages I visited over the last year, telling people, and the next day the government is not supporting a simple telehealth application, then you become disappointed, because these people, they don't take you seriously anymore when you talk to them, because you don't offer them a little example. What is this e-health for them? I went to the desert and I used my credit card. Banking, why? Why in banking is this? There are forces that for some reason, they don't want e-health to become a reality for various reasons. It's not the right place to bring such issues, but I am convinced that some forces stop the citizen from having this, and the reasons are maybe obvious. I made a statement, a press release, an interview in Cyprus, and I said Cyprus will benefit 200 million in from health budget if we apply e-health. And nobody in the government said, well, what is this professor is saying about? Is he crazy? 200 million a year? Minister of Health, the Minister of Finance, they didn't bother, nobody. Because these 250 million, somebody is doing in double prescriptions, MRIs, somewhere are spent. It's not crazy. So nobody is caring about that, you say. Therefore, I'm not saying it's a conspiracy behind, but citizens must come forward. And having said that, I would like to acknowledge the presence of a person in this room, is Marcelo Vergara, who has been in this for many years, 20 years with HEPSOS. We're discussing these issues there, and 20 years and more after, we haven't got that far. Why? And I don't want to give the, but you listen, Marcelo, in some sessions and ask him why his idea, and of course it's not only Marcelo, but many other people here. This is the biggest issue. Why they don't allow e-health to be applied? Technology is there. Something, maybe I pray to God that to help us from these forces that are intervening. I wasn't planning to say this today, but excuse me for expressing my deepest concerns. Why? And I'm not going to say any more today about this issue. Thank you.
Would you like to comment, Ms. Tsouma? I wanted to be.
I would like to comment. I would like to say, well, in order to, because we're talking too much and we're not applying. So, sorry, but Greek citizens have this lucky. They are very lucky. They are very fortunate. Well, Greek citizens have the e-health service, My Health application, which is our digital health record in their phones.
Yeah.
So Greek citizens have already these things applied. That's why I'm talking about friendliness and trust, because in Greece, at least, we are having all these results. So we must use them in order to citizens to be familiar in all these good things that we are talking and discussing in some close groups.
But hopefully the point is that Greece is not just a silo. I mean, this will be kind of not copied, but we will see other efforts like that in other member states, so we can achieve this kind of European
That's
health
why
union.
we are doing this.
Of course, that is the whole point.
These sessions.
Yeah.
That's why.
So, Professor Bamidis, if you would like to comment on the secondary use of data or anything that has been said so far.
I wouldn't like to repeat what the others have said, which I very much agree with, but I would like to also pinpoint that it is necessary to have secondary use of data, especially for research purposes. I think as in Greece, we are lacking these opportunities so far because in the past we didn't have any such digital data. Now we need access to these data in such a way so that we can cultivate this ecosystem upgrade, I would say, upscaling. We need to, from research purposes, to produce new knowledge, new research, and as Christos said, to reapply this into the primary use cases. And I think this is vital, and I think some countries are slightly further than us on these, and they are doing this. They are cultivating this notion at the local levels. I have seen examples in Finland, for example, in the Nordic countries, which, you know, we think we are there, but they are much further away from us in that sense. So we need to achieve this level, I think.
I think there's different speeds in different sections and sectors. Would anyone from the crowd like to comment? Please, could you go to the microphone, please? Could you? Thank you. There's a microphone in the middle of the corridor. If you could move, or would you like me to get you the one I'm holding?
Don't worry, I don't have to speak about yesterday much. Just one question. How many physicians are there? Real physicians? Okay. The answer to your question.
Yeah.
We speak about digital health.
Without the
Nobody is clinician or physician practice. One behind.
Hey,
My hero.
a unicorn.
My hero. Okay.
The unicorn.
My hero.
No, but you have a point.
About 30 years, Christos Schizas make the same questions 30 years before. When I knew him, he was dark hair, etc., and I have more dark. Nothing changed. The questions are the same. The only doesn't change is Olympiacos was champion, it's still champion. Thank you very much.
Dear God. No, but you raised a very important topic about involving data holders like physicians and hospitals more and kind of incentive. I think the conference will touch upon this in later sessions. I think we've run out of time. Yes, I would like to thank you all so much for this conversation. I think it just kind of opens the door to everything that this conference will deal with in the next few days. Thank you for listening so carefully to us. And I mean, thank you again, and success to the conference. Thank you so much.